Do you wonder how they do it? You know who I'm talking about, the master educators here at Mayo. I'm Lottie Derby, Director of Faculty Development for MSGME. Take 5 minutes to listen to Master Educator and multiple Teacher of the Year recipient, Dr. Nishimura, speak about teaching, self-directed learning, and reflection.
Hello, I'm Rick Nishimura. I'm one of the cardiologists here at Mayo for the last 35 years and have really developed a passion for education. Now, as educators, we've been taught how to give scientific presentations from behind a podium to large audiences. But it's actually become quite clear that the greatest impact that we as teachers can have on our learners and trainees is the education that we provide either one-on-one or in small groups, particularly directly during patient care. And to me, it's this experiential learning that has the greatest impact for our trainees, and I'd just like to provide some of the insights that kind of have developed over the past decades of teaching. The most effective teacher is not necessarily the one who transfers his or her own knowledge during rounds, but the one that teaches the younger generation actually the art of what we call self-directed learning. Thus, when I'm either on rounds in the hospital or with a group of trainees performing a cardiac catheterization, I'll never give a didactic lesson. Instead, through a series of questions, I'll kind of discover and learn what they know or what they don't know regarding the disease or a clinical question. And the question kind of starts at the basics and gradually moving from the simple to the more complex. Not only covering the basic knowledge, but also the comprehensive clinical application and the ability to synthesize all their data for clinical decision making. Now, once the learners have then shown that they're actually at the limit of their own knowledge, I make it their responsibility to seek out the answers regarding the knowledge they either don't know or think they know but are uncertain about. And reflection's interesting because even though it's a much discussed topic in the educational world, I found it very infrequent that our fellows and learners are also asked to reflect upon their patient care. And after every session that we have, I'll ask our learners to write down their reflections after a day in the clinic or the laboratory so that they think about what they might have done differently and what they might have done well. But this reflection should also include their, quote, gaps in the knowledge that were pointed out to them, coupled with their own learning that they have done to fill in their gaps. And thus, they'll complete their basic knowledge regarding a disease or clinical scenario. And I tell you, they actually get excited about it. Some of our learners have actually written several pages of reflection each day that they're with me, and then they send them to their colleagues in order to share the knowledge gained through their clinical experiences. Now, one of the most important things about this type of teaching is not just to transfer the knowledge, but to actually train the learners how to seek knowledge on their own. In other words, to propagate mechanisms for lifelong learning. And I will say that many of my learners who've graduated years ago will return to see us, meet us at a meeting, and kind of state how they're still using this reflection model to continue to enhance their medical knowledge in patient care. And I think one of the most important things is that when we as staff make errors in judgment or see our own knowledge gaps, it's important to share our own reflections with our learners so that they realize that this truly is a lifelong endeavor. So in summary, we have a few points here, kind of a take 5. Number 1, optimal learning does occur at the point of care with questions that come up regarding an individual patient's disease or condition, either at the bedside or in the laboratory or in the coronary intensive care unit. Number 2, it's useful to use a Socratic questioning method to identify the gaps, let's say, in a learner's knowledge. Number 3, instead of telling the learner the answer to the question, it's useful to encourage the whole concept of lifelong learning and have them find the answer themselves. 4, reflection is important, should be encouraged for all encounters, looking at both what was done during patient care and gaps in knowledge. And finally, last number 5, we as teachers and role models should continue to talk about our reflections and what we've done right and what we've done wrong and what we need to know to our learners. Thank you very much.